Hello, this is Angelica at the Osteopathy and Healing Center. And what I'm going to do today is talk to you about the body, some very interesting points, and then we're going to distinguish some features that medical intuition has and that osteopathy or an osteopathic manual therapy does. So the information that I'm going to be sharing with you, a lot of the information is in the Human Body book by Dorling, Kindersley, 2014. And in that book, it talks about the Greek physician Hippocrates, that lived around 460 to 370 BCE, and he taught that disease could be identified and it could be treated. If you use your intuition or you have a medical body scan done, it will help to uncover disease processes starting to occur in the body that have not yet manifested. When an osteopathic manual therapist is giving you a session starting to adjust and balance the body, then it also decreases the potential for disease states to occur within the body or that manifest. So good mental, emotional, physical, and spiritual health can be manifested for disease not to occur in the body. So if I am taking care of my body, and I'm taking care of my body at these different layers, and again, these layers could be looked up online, to see how we have all these different layers that include our mental emotional balance, that include our physical bodies, and that include a spiritual level. So when these levels are balanced, then disease will not manifest as likely in the body, because you're going to be taking care or preventing it from occurring because you're taking precautionary steps to take care of the underlying issues before they manifest. So in the book, it continues to talk about the microscopic body, and microscopists showed that living things are made up of smaller units. Robert Hooke, who lived around 1635 to 1703, likened these cells to rooms of monks in a monastery. So when you're getting, a medical intuition body scan, the cells can also present imbalances within them. So an osteopathic manual therapist is also affecting the body at this level, the cellular level. So once the environment again is balanced, or there is homeostasis, the cells in the body at the micro level to the macro level can then heal. There was a statement in the movie What the Bleep Do We Know, and you probably heard this statement a lot as well. And in university, when I took the neuroanatomy course, it was said that the neurons, they fire and they wire together. So if you think, for example, that I am not healthy, and you keep thinking that day after day after day, the body will respond to the thought, and it will affect our bodies in such a way that it will be unhealthy. Hawkins also, in his book, one of the great books that I really like is called health and recovery, he says that whenever you have this thought come to your mind, such as, I am not healthy, to then say, I am not subject to this. I am only subject to what I hold in mind. And then you say something like, I am healthy. In the book again about the human body talks about our nervous system having these association neurons in the brain, and each association neuron has these links to thousands of other neurons, and they form this communication network with countless routes for these nerve signals then to travel between and communicate with our bodies. I wanted to share that example with you because again it shows energy is real, and that is an example of it. There's also what's called sympathetic ganglion chains that control autonomic functions in the body. If we go back to the brain, it's made up of what is called the cerebrum and the cerebellum and the brain stem. So the brain stem is in the back there, and the spinal cord that then travels down our spine. Their function is to have this constant flow of signals, and they arrive and they depart through 12 pairs of cranial nerves that start in our brains, and 31 spinal nerves, pairs of spinal nerves that start in our spinal cord. So each nerve has a sensory neuron and a motor neuron. Now the sensory neuron, it carries information about sensation from the body. And there's an area in our brains that it travels to. The motor neuron, it carries instructions from the brain to muscles in our body. Now, part of the nervous system automatically controls vital processes. You probably can think of a number of them that we're not aware of. For example, our heart rate, the beating of our heart. Also, an osteopathic manual therapist will know how to inhibit hypersympathetic nerves. So to inhibit, they will hold, for example, constant pressure in an area where the nerve exits the spine. Or they may want to stimulate the area. So they may use a technique that's called oscillations. And as they're oscillating, they're also stimulating the nerves. And the faster the oscillation is, the more stimulation it causes. But you can also have a slow oscillation that causes a relaxation through the body. So we talked about the brain, and now we're going to continue going down to the spinal cord, where it has relays of nerve signals between the spinal nerves and the brain. So each nerve has two roots, and we talked about one containing sensory neurons that brings the incoming information to the sense organs, and two being the motor neurons that carry these outgoing signals to our muscles that then allow us to produce motion. So the spinal cord also controls automatic body reflexes. So I'll give you an example. You touch something hot. What do you do automatically? You lift your hand. Or if you touch something sharp, same reaction. So these spinal nerves are working not only in the patient when they're getting their osteopathic manual therapy adjustment, but they're also working in the practitioner who's picking up this information as they're working with the body and the tissues and how they feel, how the skin feels. Is the muscle contracted? Has the nerve relaxed? And now are the muscles relaxed? So now I want to go into talking about the limbic system, which is made up of the amygdala, and it triggers feelings of fear, and it helps us to assess danger. So during a medical intuition body scan, fear can come up. We see fear a lot in the work we do. Fear likes company. The practitioner, the intuitive who's doing the body scan, just has to continue to report what they are observing, and then that feeling goes away. Now, you yourself, I know I have been able to pick up energy shifts. For example, I'm doing my osteopathic manual therapy adjustment, and I'm picking up fear in my body because I'm kinesthetically aware. And so I can sense or intuit that the patient is feeling fear. And so I may ask them if they have a question about what we're about to do, or the adjustment, or the osteopathic session in general, to give them an idea, just to ease them out of that fear so that they can start to relax. And then I can start to work with the body. So it's an example of using our own bodies, if you're kinesthetically aware, to then be able to help the patient, yes, be aware of the fear that they're feeling, and then through just talking, it could ease that as well. So I'm going to give you an example of me doing an osteopathic manual therapy session and also doing the healer's hit style of medical intuition. So this is where I'm doing my adjustments, and if something just happens to come up, not that I'm looking for it, searching it out, but if something just pops out from the body to the surface giving me information, then I'm going to use this and then tell the patient this information. So this is an example. I'm working with the patient's body, and then I'm using the healer's hit style, and I start to feel fear surrounding this patient trying to have her house sold. Or another example is I'm working with the patient, and then I feel that fear come up related to work. And so I actually see an image of the person sitting at work, or I feel this fear that's related to a house. I may get an image of a house. And this is completely fine when it comes up. There is also a technique that may be beneficial if people are experiencing these emotions when you're working on them. And this technique is from the Touch for Health book by Matthew T. And I have it here. I'm just going to show it to you. That's the book. And it talks about this technique to be able to just calm the nervous system that goes to the stomach. So when a lot of people feel fear, what they'll usually feel first is some tension in the stomach area. So what you want to do is place the fingers kind of like in a triangle, And you're going to face the fingertips to the forehead, on top of the forehead, laying them like this. And you hold these points. So these points are called neurolymphatic reflex points, or neurovascular reflex points. On the head, they're neurovascular. On the body, they're neurolymphatic. And you just hold there for a couple minutes, and they can again be running through that process of feeling that emotion, such as fear or some other emotion. They could do it on themselves, or they can have someone else do it on them as well. Next, I wanted to talk about the parahippocampal gyrus, and this deals with anger, fright, and recalls memories. Same with the hippocampus. It also deals with our memory and our navigation. So I want to bring out these two areas that have to do with our memory, because it can come up after a body scan. So what I mean by that is, let's say a past life comes up during the session, and more details next day or following the session, next days to come, may surface, and the person may start to remember these memories. And then they can journal it down, and as they get more information and detail, they can add that information as well. Having said that, you may be working with a patient and they start to recall memories. And it's not at random, of course. You may be working at a certain area of the body, and then they start to recall something in their childhood. And then that memory that they're recalling could be associated with the area that is imbalanced in the body that you're working on. Or it is important, that past life, for it to come up during the treatment, because it can relate to something that is going on in their life or that is manifesting in the body. So now I want to talk to you about the cingulate gyrus, which is also in the brain, and it deals with emotions. We've already touched on this a little bit, but remember, emotions are not something to be afraid of. They're part of our lives. We experience them. And if you want to actually get more information about each emotion, what it is, you could look again at David Hawkins' book. Pretty much in all of his books, he talks about first each emotion. And he's also calibrated each emotion, so he used muscle testing to be able to come up with what's called a map of consciousness, that he puts each emotion and then calibrates it on a logarithmic scale, what it calibrates at. And he describes about that emotion in detail. So during the body scan, so when I'm talking about the body scan here, the medical intuition body scan, again, we're talking about the attending style or the attending model. And then we're also talking about, in practice, the healer hit approach. So when we're doing this, emotions can come up. It comes up because it's important. And it's important for the practitioner to be able to report them, or if they feel shifts in energy, to also report it to the patient. A lot of the times when working with the patient's body, an emotion comes up and the practitioner just tells them what that emotion is. Like, for example, I'm feeling the emotion of sadness. If you sometimes just even mention what that emotion is, acknowledging it, it will resolve the issue itself. Or it will let the patient to look more into that certain emotion to see how it's impacting their health or that area in their body. Or you may just be able to continue working on that area, and as you're working on it, the issue, the emotion gets resolved. So I want to talk to you about touch, about skin and touch. We know that the skin has a big job, a role, and that is to be able to sense touch. So when we're working on a patient, they can sense our touch, and also the practitioner can sense touch. So they both are communicating at all times. And the Braille system is for people who may have sight problems. So they use Braille to read using their touch. And the same thing happens to a person who's using the system as an osteopathic manual therapy practitioner, in the sense that they're building up a part of their brain that is related to sense of touch throughout their practicing years as they get hands-on experience. So during later studies in osteopathy, I got into more finer touch, such as distinguishing the cranial movement in the bones, or you might have heard of cranial sacral work. So working on the cranial bones, working on the brain, working on the organs, that would be more of like a finer touch. And an osteopath learns and develops these neural networks inside the brain that is related to sense of touch throughout the years. Now I just wanted to talk to you about the skin itself. It has a thicker dermis layer that contains sense receptors that can help us detect changes in temperature, in touch, in vibration, in pressure, in pain. So again, just think about, like, when you touch the person and you're doing a treatment on them, both the person, patient, and the practitioner can detect these changes, and they can use this information to find areas in the body that are out of balance. And then again, after they balance it, they can go back and reassess it and see if it's been balanced. So the eyes and seeing, there's more than 70% of the body's sensory receptors in the eyes in the form of light detecting cells. So light is turned into electrical signals that are sent to our brains, and then that changes into images that we see in the eye, in the brain. So the retina, the innermost part layer of the eye, has 1 million of light detecting cells at the back of the retina that will send this image, this information, to the brain. Again, another amazing example of energy being real, of our bodies being able to convert, in this case the light energy into electricity, into those little nerves in our own bodies. When you think about hearing and our ears can detect waves of pressure, and we call those sound waves, and they will travel through the air and form a vibrating sound source. And then the ears will turn these waves into nerve signals, which the brain can interpret as sound. So inside our ears, there's these air-filled middle ear section. Behind the eardrum, there is 3 tiny bones called the ossicles that can convert the sound waves into mechanical movement. And the fluid-filled inner ear then can convert the movement into nerve signals. So So hearing happens because there are sound waves that are funneled into the ear canal that strike our eardrum, making it vibrate and making those 3 bones or ossicles vibrate. And they move back and forth. And then one of the 3 bones, called the stirrup, pushes and pulls the flexible oval window like a piston. And then this sets up vibrations in the fluid-filled, it's called the cochlea. Inside the cochlea, there's sound-detecting hair cells that turn these vibrations into a nerve signal that pass along then the cochlear nerve to the hearing area of the brain. So this again is another wonderful example of energy being real. Just by examining these different senses within our bodies, we can learn a lot about energy. If you have issues with balance, then that could be also because of things happening with the ear. So the inner ear, there is a vestibular nerve that carries signals from the balance organs to the brain. So the balance organs include the vestibulate, the utricle, and the saccule, which are balance organs. And an osteopathic manual therapist is able to work on this area, which is the temporal bone, or is able to work on this area in the back, which is the cerebellum, to help patients who have troubles with balancing. There's also the semicircular canals that are also balance organs, and the cochlear nerve carries these signals from the cochlea to the brain. Okay, if you think about smell and taste, both detect chemicals, so works on a little bit different process. There's taste receptors on our tongue that also have nerves that go to the medulla oblongata, to the brain. And there's 2 different nerves depending on which part of the tongue you're talking about that they innervate. So the first 2/3 of the tongue, that's carried by the facial nerve, that's called, the branch of it is called the chorda tympani. And the glossopharyngeal nerve carries taste signals from the rear 1/3 of the tongue. So smell, olfactory receptors, there are in our nose that pick up the odor in the air, and they relay these signals to what's called the olfactory nerve, and that goes to the olfactory bulb, and then that goes to the brain. So there's olfactory receptors in our nasal cavities that have hair or cilia that project into the watery mucus of the nasal lining. Again, an amazing example of energy being real. So what I want to do next is I want to take a look shortly at the hormones within the body and the glands in the body that produce these hormones. And osteopathic manual therapists can work on these different organs and can help to balance these hormonal levels or hormonal regulation of the organs. And when doing a medical intuition body scan, hormones may present themselves as being also out of balance. So hormones that are called the endocrine system, and there's a collection of glands that release these chemical messengers or these hormones into our bloodstream to control body processes like growth and reproduction. So an osteopath or osteopathic manual therapist can affect these glands, and in effect when we affect the organ, we can also affect the hormonal release. So the thyroid releases a hormone called thyroxine, and it targets most of our body cells. and it upregulates the metabolism or chemical processes that occur within our body, such as growth, which we mentioned, and development. A second hormone that is released is called calcitonin, that triggers the bones to be able to take up the calcium from our blood. The adrenal glands, you might have heard of them, especially when you get stressed, it affects the adrenal glands. So if I know someone's really stressed or they're going through a very stressful period in their lives, I'm going to go and I'm going to look at the adrenal glands to be able to balance them out during that phase in their lives. And the adrenal glands, they release what's called corticosteroids, and they regulate salt and our water levels within the blood. They speed up as well our metabolism, and they deal with stress. If you look at the kidney, the medulla in the kidney releases epinephrine that prepares our body to deal with threats. The pituitary gland you might have heard of as well, which is inside our skulls. They travel on the inside of the brain. There's an anterior and there's a posterior lobe of the pituitary gland that releases hormones such as the antidiuretic hormone that controls urine water levels, or releases oxytocin, which allows the uterus to contract, like during pregnancy. The kidneys are another thing that an osteopath can also manipulate by going through the abdomen, and what can happen commonly is that it can drop down, and there's different degrees that it could drop down, and we call that ptosis. So an osteopath can just very, very gently lift that up, and there's a video that I show how to do that as well on. The pituitary gland can also be worked on, especially for women who have issues with pregnancies or infertility. An osteopath will want to look at that. The pancreas, yes, people who have diabetes, you're going to want to look at the pancreas and make sure that it's balanced. And there is these gland cells that make digestive enzymes, and enzymes break our foods down to release these nutrients along ducts into our small intestine. And the endocrine tissues will then release hormones. So you might have heard of the pancreas releasing insulin and glycogen, again, into the bloodstream that keeps steady levels of our glucose levels in the blood. The hypothalamus is important because it controls body activities, and it controls these activities sometimes through the pituitary gland that we've already mentioned. The thymus is very important in childhood because it ensures normal development. There's white blood cells, T cells. There's white blood cells called T lymphocytes, and they help to identify disease and to destroy disease-causing organisms like bacteria. So an osteopathic manual therapist can work on the thymus or other immune organs like the spleen to be able to increase the immune system within the patient so that they can be able to just heal optimally through whatever they're going through, like an infection. The heart, which there's also a video I show on how to manipulate the heart both in seated position and laying down. And the heart is a pump, it's a muscular pump. And the heart, so there's the atrium and there's the ventricles. The upper are called the atria, the lower are called the ventricles. And we have a right and a left side. And the right ventricle, it pumps oxygenated poor blood to the lungs, which then pick up oxygen from the lungs and then go into the left atria and into the left ventricle that pumps then this oxygen-rich blood all around our bodies and then back to the right atrium. And there is coronary circulation, that's around vessels, blood vessels around the heart. It has its own supply, and there's left and right coronary arteries from the aorta that supply the heart with oxygen-rich blood. There's coronary veins that take oxygen-poor blood to what's called the coronary sinus, and then it empties the blood into the right atrium. So with every heartbeat, there's the arterial walls that will expand and shrink as the blood from the heart surges through it at high pressure. The veins will carry the blood returning from capillaries at low pressure. So the walls, layers of capillaries are much thinner. And the capillary walls let the food and oxygen pass from our blood into our surrounding tissues. So fighting infection, white blood cells in our circulatory and lymphatic systems from our bodies, which is our immune defense system, have cells like macrophages, have cells like lymphocytes. White blood cells are also called T cells, B cells, neutrophils, and they track down pathogens and they eat them to respond to invasion of pathogens by detecting them and also destroying them. So I mentioned this because an osteopath can also do sinus drainage, for example, to help with decongesting the sinuses, and they can work on different organs to be able to naturally allow the person's own immune system to just kick in and resolve whatever it is fighting against. There's antigens, and so those are remains of the bacterium on the macrophage surface that activates what's called T helper cells. And these helper T cells then release substances that switch on B cells that target the pathogen. And B cells multiply to produce plasma cells. Plasma cells release 1 trillion antibodies into our blood and lymph. And the antibodies track down pathogens for macrophages like white blood cells to destroy it. Now, we talked about the bloodstream. We've been mentioning it several times. And in the blood, there's what's called red blood cells that deliver oxygen to our tissues. There's platelets that help seal wounds by forming blood clots. And there's the spleen, which we mentioned as well, that helps to remove old, worn out red blood cells and helps to recycle iron. So inside our lungs, there's these alveoli that take up oxygen from the air that we breathe in and pass it into our bloodstream, which then delivers the oxygen to every cell in our body and releases that oxygen and energy from food in a chemical process that is known as cellular respiration. So during a body scan, the body can show up that the body may be fighting some infection, and an osteopathic manual therapist can work on the immune system to boost it, to prevent or to help the body through that infection. There's another area that the body can present for attention, and that's the gastrointestinal system while doing a body scan. Again, what the intuitive will do is write down that there's issues within the gastrointestinal system, which part there's issues, and report the information. So once they got the information, they can either hand it to their health member or healing team that can then work on it. And yes, the osteopathic manual therapist is able to work on the intestines, stomach, large and small intestine, liver, to be able to help with the process of digestion. Now, digestion includes our liver, It helps to balance chemical makeup of blood and oxygen-rich blood from the heart and nutrient-rich blood from the intestines pass through it. It releases nutrients into the bloodstream for circulation, or it stores it, and it makes bile, removes poisons from our blood, destroys bacteria, recycles worn out red blood cells, and then as this happens, it generates heat, and it keeps our bodies warm. Waste disposal is also an important part, and body cells continually release waste substances such as urea made by the liver into the bloodstream. And osteopathic manual therapists can also help with the elimination process. Once the organs are functioning optimally, then the elimination can just occur naturally within the body. So that just talks about our bodies, how fascinating they are, and we give examples of our senses and how energy is real, and we talked about some of the distinguishing facts about doing a body scan using the attending model or the healer hits approach, and distinguishing that with osteopathy, or what an osteopathic manual therapist can do once they have gained the information about what's happening with the body. So I hope you enjoyed that. There's also a page on the website. It's called Medical Intuition, and it talks about what medical intuition is, and there you will also find that I am offering the 15-minute medical intuition sessions. So if you have a question about your health, or a specific question about something that the body's going through, then you can also write that question down, or it could be a general question. It's like, I'm not sure there's nothing really wrong that I know of, but does my body have to say something? So that's fine as well. And then using the attending model from the medical intuition style, I will then tap into the body, and I'll be able to find out what the body has information to share with you about that certain question, or in general. So you can check that out at our website, osteopathyandhealingcenter.com. So I hope you enjoyed this video. Have a good day.